Hello everyone! Welcome to another webinar from the Steps Forward Innovation Academy. Today's topic is putting physicians at the center of AI and digital health. And over the next 45 minutes, we will share practical perspectives on aligning technology with clinical workflows, building confidence in new tools, and ensuring digital solutions deliver real-world value for both physicians and patients. Please note that this webinar is for informational purposes only and is believed to be current and accurate at the time of posting. Please consult a professional advisor for specific medical, legal, financial, or other advice. References and links to third parties do not constitute endorsement or warranty by the AMA. And let's just take a moment to go over your experience today as an attendee. If you're joining us here on Zoom, welcome. You will see a dark menu bar either at the top or bottom of your window. There you can access a selection of resources related to this webinar, including links to our AI Resources Hub and today's slides. There's also a link to stepsforward.org where you will find all of our past toolkits, podcasts, and webinars. And if you don't see these options, select the three-dot More button to access the resources and Q&A. If you're joining us on YouTube or LinkedIn, welcome. You can follow the link in the description to join us here on Zoom, access the resources, and ask questions for our speakers to answer. After our webinar concludes today, you will be able to claim 0.75 continuing medical education credit hours. You can follow the link in the Resources tab to the AMA Ed Hub and claim the credit there. We'll remind you all this at the end, but for now, I'd like to introduce you to today's speakers. Joining us, we have Dr. David Rhew, the Global Chief Medical Officer and VP of Healthcare at Microsoft. And from the AMA, we have Dr. Margaret Lozovatsky, our VP of Digital Health Innovations here. Dr. Lozovatsky, I'm happy to pass it off to you.
Fantastic. Well, thank you for joining us, everyone. We're going to start off with a little bit of an introduction on some of the research that we have done at the AMA. But before we get there, let me very quickly run through the learning objectives. We're going to talk about key barriers and facilitators influencing physician engagement. We're going to identify effective strategies for engaging physicians in meaningful utilization of technology to ensure that these tools are truly enablers to deliver clinical care to our patients, and discuss practical approaches for integrating these tools into the clinical environment. And so, like I said, I'd like to talk a little bit about the research that we have done on what physicians are saying about these tools today. And then we're going to get to our fireside chat with Dr. Rhew, who is going to help us understand some of the Microsoft perspective on how they think about the development of these tools. So we have been doing research on digital health for many years, and this most recent iteration, you guys are going to see a bit of a sneak preview on what we have found in 2025 as we realize that these tools are evolving very quickly and the landscape of how clinicians are using technology is changing quite a bit. And there's a few interesting findings that I wanted to highlight today. One of which is that the physician sentiment towards technology is really remaining strong. We're seeing physicians saying that these tools bring advantage to their ability to deliver care, and there's a lot of excitement out there about the utilization of technology. We're also seeing that as we are now getting to a place where these tools are part of our environment, and we have a new generation of physicians that have never practiced without using technology, adoption is really stabilizing for some of the existing digital health tools. And the emerging tools are showing slow uptake, but have not yet stabilized. And there's a lot of opportunity. We're going to talk about that. We hear from physicians very similar themes about what their requirements for adoption are, and we're going to jump into that in a little more detail in the upcoming conversation. And we also hear a lot about what the barriers are, much of which has to do with trust and our ability to rely on the technologies. We also hear across the board that physicians really want to be engaged in the conversation. And this is exciting. I don't know if we've always heard that from our colleagues, but we're at a place where 70% of physicians want to be involved from design to implementation to integration. And they're really interested in adopting these tools, but they want to be a part of the conversation. Next slide. So as I mentioned, adoption is really stabilizing with the existing tools. What we're seeing is things like telehealth and virtual care tools, remote patient monitoring, clinical decision support. This has been around for a long time. We saw a huge increase during the pandemic in adoption, and now we're stabilizing to where we think it's going to be. And we're seeing slow uptake of some of the newer tools. Things like wearables are getting more and more adopted in the coming years. And of course, AI is going to be a large part of our conversation today. Next slide. We also, in addition to the digital health overall survey, we also do a specific survey on AI. And we have done that for 2 years now, and our third year will be upcoming very soon in the next few months. And what we found, which I think is really fascinating, is that the rate of adoption went from 38% at the end of 23 to 66% a year ago. And I am anticipating our next survey is going to go up even higher. But this is a rate of adoption that we just don't see with clinical technology. I have never seen this outside of the pandemic era. I think that's really exciting and very telling that many of these tools are perceived by our colleagues as something that is additive, and there's a lot of enthusiasm out there. And I think one of the biggest questions is how do we capitalize on that? The top uses are things like documentation tools. Of course, ambient is a top of mind for folks, but also tools that are helping with translation and creating of discharge summaries, and summarization as a whole across all of our clinical data is something that people are very interested in. Next slide, please. We're seeing that the top use case that is being called out in a lot of our surveys is the decreasing of administrative burden. There's a lot of interest in looking at these tools and thinking about how can we decrease administrative burden while improving patient outcomes. How can we look at decreasing medical errors, streamlining many of our workflows? We recognize that a lot of what has happened with the technology rollouts has added to the administrative burden of our physicians. And so the responses are very consistent across the board with an interest in looking at how we can continue to improve the workflows while truly impacting patient outcomes. Next slide. Physicians definitely still have a lot of key needs that they are calling out when it comes to how we want to experience the technology and what will improve our ability to adopt it in our clinical environment. A lot of discussion about making sure that there is governance around these tools so that we know that the outputs are reliable and we're able to utilize them in the clinical environments, that they're well integrated and there's coverage for them. And very clear trust is at the center of a lot of the things that are being called out. Next slide, please. Other factors that are influencing broader adoption is integration, as I mentioned. That tends to be top of the list. It needs to be part of my workflow. It needs to be easy to use, the path of least resistance, as I like to say. There needs to be technical support around it. It has to be covered in the environment. It has to be proven to actually provide outcomes that are as good as traditional care, if not better. And so all of these, again, are very consistent. A lot of conversation about privacy and security to ensure that we're protecting our patient data. Next slide. Cost continues to be a barrier. This is something that is discussed across the board in all of our survey results, but the implementation costs are very high. There is a need to prove ROI. There's a need to ensure that there's reimbursement pathways, and so that has come loud and clear across all of the survey results. Next slide. And physicians, again, want a voice at the table. They want to be involved in every aspect of design, implementation, and integration, and they're very interested in ensuring that these tools are implemented in a way that is additive to our ability to care for patients. Next slide. And so understanding all of this, the AMA has recently announced that we will be creating a Center for Digital Health and AI, and it's going to have 4 pillars that are consistent with what we discussed, some of the needs that were communicated to us by physicians, and those are clinical workflow integration, education and training, collaborating across the ecosystem. And we're joined here today by a physician leader from a technology company and policy and regulation leadership. And so more to come on the development of the center, but I do want to jump into the conversation, which is at the center of this, with my colleague here, Dr. Rhew. So thank you, David, for joining us today. We're thrilled to have you. Let's start with AI, top of mind for everyone. It's been a hot topic in the last few years, and we've certainly seen physician enthusiasm and rapid adoption. So what are your thoughts? Is it hype or is it real?
Yeah. First of all, thank you for inviting me, and it's great to see you, Margaret, as well. Just a little fun fact about myself. In 1988, I was an undergraduate, and my major was computer science, and my thesis at the time was AI in healthcare. And I can tell you, at the time, nobody really cared. Nobody cared about my thesis, the topic of AI in healthcare, or even AI. And largely it was because the technology was not quite as good as it is today. It really has improved pretty dramatically. And what we've seen is this improvement from everything from natural language processing to generative AI to agentic AI. And because of the pace of innovation and the things that we traditionally use to measure AI, which we call benchmarks, and the fact that AI is surpassing every benchmark we put at it. So we have to kind of create these newer and bigger ones. It's gotten people really excited. And I think that now people are starting to realize that it can do things as well as experienced individuals, and it can do it at scale. And so it's given people a whole bunch of different ideas of how it could be deployed. Now, I think the reality is it takes time for this to get deployed. And I think some people have said, well, wait a minute, what have we seen in terms of results? Is this actually leading to all the benefits? And I really think the way I would look at that is both in terms of the time frame and the metrics. Because if you're, let's use a short-term time frame, because a lot of folks are focusing on like, what about now? Are we getting value? And I think where I've seen the greatest amount of valuation is really around the ambient scribe. It's gotten a lot of attention. It's probably one of the most, kind of widely used. And then on one end, you've got some folks that say, well, it's saving time. It's reducing about anywhere between 15 to 60 minutes, per day. And some people are saying, well, that's nothing. That's really not a whole lot. And I think, yeah, I really have to kind of go back in terms of like, oh, well, is it for every physician? Because there are some physicians where they spend very little time documenting. It's really on the average. So the other metric, which I think is even more compelling, is the fact that 80% of the clinicians that use it are feeling they have a better experience. And in fact, we've actually demonstrated in many studies that it reduces burnout. So if we go back to why this was developed, I mean, there are many reasons why Ambient Scribe was developed, but one of the reasons, if we go back in time, not too far long ago, clinician burnout was the topic, and everyone was saying we have to solve this problem. And so if we remember at the time, 50% of clinicians all burned out, leaving the practice. What can we do? Well, we had this technology and it's working. And so it is actually working on the things that we care about. So if our metric was around burnout and improved satisfaction for both clinicians and patients, home run. If it's about, are we achieving that maximal time savings where we're now becoming more highly efficient and doing all these other things? We're not quite there. Now, that's not to say that we couldn't get there. And so I think what we have to start thinking about is think of this as a journey. We're like in the early innings of a long ball game. We've had some great success, but it means that we can actually build off of that. And there's some really exciting things that we can do beyond what we're currently doing.
Well, I love that. I think that's a great way to look at it. And much like all technology implementations, we're still learning and we're still early in the iteration of how these tools are going to evolve. And that's why there's so much excitement about it. So, as you're thinking about the future, we talk a lot about physicians being involved across the whole life cycle of technology. And we know from our research there's a lot of desire for that. So, how do you define physician-led innovation? And how can we ensure that the physician's input isn't just requested, but it's truly meaningfully incorporated into the design and deployment of these tools in the clinical environments?
Yeah, you're absolutely right. I mean, physicians, we are typically the captain of the team. We have to be captain of the ship, that the AI ship. And so what does that mean? We need to think about what problems are we going to try to solve? I mean, that requires a clinician, physician input on this. We need to figure out what's the current workflow, and with AI and a bunch of other tools, what should the new workflow be? And that requires a physician or clinician to be able to start thinking about that. And then, like we just talked about earlier, we need to have metrics for success. And these are things that clinicians and the patients and others through a clinical lens would say these are important things, that these are the things we should be measuring. And so certain touch points require a clinical point of view in leadership. I'm going to give you an example of something that I had done in the past, which really highlights the role of the physician. And this was a program that I worked on with Kaiser Permanente. And at the time, the problem that we were trying to address was the fact that many patients, after a heart attack or a variety of other types of cardiac events, were asked to do cardiac rehab, but only 40% of people were completing the whole program. And we know from the medical literature that if you actually complete the program, you can save anywhere between 7 and 17 lives. Right? Like for every 7 to 17 patients, you could save a life, I should say. And so it's a very important program, but the fact that half of the people or less than half of the people who are completing it is a problem. And so what they said is, well, how do we increase the adoption? And so when we went to the clinicians and we asked them, you're like, what is the issue? And they're like, you know what, the issue is that these people, it's too difficult for them to come here. A lot of people live, far away. It's a lot of, 3 times a week. They have to come in, parking, costs. Some people have jobs, some people have families, and it's a long period. So that's a big challenge. And so then we asked them again, well, the current program, do you have to be in the facility? And they said, well, ideally, we'd like to have them do it at home. So I was like, well, we've got some technologies. We might be able to put together a program. We could do in-home cardiac rehab, leveraging wearables and patches and phones and all the different technologies we had. And the program was highly successful, both in terms of the metrics that we suggested that the physicians encouraged us to measure completion of the program. So it went from 40% to 80%. So that was great in itself. And the second one was the readmissions. It dropped from, this is at the time, it was around 11, 10, 11%. It's now like less than 1%. And that was for 120 patients. And so the next thing that we said was, well, can we scale this to 1,200? And it scaled. And now it's first line therapy across all of KP. There's been over 30,000 patients. They're still seeing the same great results. And it really is a great example because physician led, clinician organized around what problem we're solving, how are we actually going to do this, and also what metrics. That was the key to making this work.
I love that. And I think there's so many important pearls in what you just shared. Part of the challenge sometimes is that we get really excited about the technology. There's a lot of cool technologies out there, and yet anyone that's ever implemented technology in clinical medicine understands that so much of the impact is the people and the process that is going to be wrapped around the technologies that we're using. And getting to the folks that are at the bedside that are caring for our patients is so important. I always say that decisions have to be made as close to the care as possible. And I'm a pediatrician. I take care of kids in the hospital, and I recognize that that's the lens that I see things with. And so whenever we were looking at tools and other specialties, just shadowing and understanding how things are done provides so much insight into how to design the technologies to support those clinicians and ultimately to impact the patient outcomes. And I love that you highlighted that because that's what it's all about, is making sure our patients are getting the right outcomes.
Yeah.
So I'd love to hear a little more and dive deeper into this topic. Can you share a little bit about how Microsoft works collaboratively with physicians to ensure that their tools create impact and are thoughtfully integrated into clinical practice?
Yeah. So I think the first and foremost, there's a series of different technologies that can be applied. We obviously use input from a broad range of stakeholders, clinicians, physicians, nurses, all being critical to that process. But the things that I want to talk about are the things that go beyond simply just the development of the product. I want to talk about the implementation. And as we think about implementation, we realize that there's a lot of things about the workflow, about the reimbursements, about the quality and the safety that we're concerned about adoption, and how do you address those? So like in the area of AI, one of the things that we hear quite a bit about is it safe? Is it something that we can actually rely on? Is it something that will uh, add more burden to us, or will it reduce the burden? And those are the types of things that have to be considered as you start building these solutions. And so as we started thinking about like this concept of responsible AI and realizing that was a critical part of both the development of the product, but also the implementation, one thing that we realized was a lot of organizations aren't doing what needs to be done to deploy AI at scale. So for instance, do they know what AI is running in their system today? Do they have a mechanism to test and monitor the actual implementation of the AI and the outcomes it's having on populations and subpopulations? Are they looking for bias? Do they have a governance process? And those were the types of things that in talking with organizations that actually did have the processes, we realized the other problem was that there just aren't enough people, time, or money to be able to do this at scale because there's just too much AI coming at the organization. And so this was one of the reasons why Microsoft, in collaboration with numerous healthcare organizations, created this group called the Trustworthy Responsible AI Network, or TRAIN. And as part of the TRAIN network, the objective is how do we take all this amazing AI that is being developed in collaboration with physicians and nurses, but do it in a way that the organization and the patients have trust in it and confidence. And in order to do that, that required a network of organizations to be able to think about this. And so the goal with Train is how do we create a process that is scalable? One, let's leverage technology to find a way to be able to do a lot of the testing and monitoring, et cetera, in a very time and cost efficient manner. But secondly, can we create a network effect? So certainly with this concept of a learning network, we talk about learning hospitals or learning health systems. What about a learning network where each site is actually taking a look at the different models they're building, and they're actually implementing it the same way, they're measuring it the same way, and they're sharing it amongst each other at the model level. So you're actually now, if one site is picking up some strange things that are happening, it's kind of like a real world of evidence type of evaluation. They can report to the other sites and then they can all start looking at it carefully. It's the power of the numbers and the fact that we're all trying to do the same things. And those are the things that we see. We see a lot of sites trying to do the same things, and we go to the next site and they're like doing the exact same things. There'll be a lot of synergy if we actually work together in a coordinated manner.
Yeah, I think that's such a good point. And I believe it was Judy from Epic that talked about being a chief imitation officer, which I thought was a great concept because, like you said, so many health systems, so many practices are recreating the wheel as they're thinking about this. We actually, in the last year, released a AI governance toolkit, which has some of these high level points of how do you set this up in your organization, because you're absolutely right. This is a challenge everybody faces. And I love that you guys are bringing people together to have that conversation so that we can learn from each other. And as these tools are evolving so quickly, it's going to be critical for us to learn from each other because no one can keep up on their own, the powers and the numbers.
That's right.
So we talked a lot about the different AI tools in this conversation and some of the feedback that we're getting from our clinicians. And of course, you'd already mentioned ambient and the power of that tool. What are some of the other promising use cases, both AI and digital health tools, that you think can truly improve care delivery and support our physicians and benefit our patients?
So I'm going to start with the patient because we don't usually kind of think about AI being involved with the patients. So, like, what are the patients struggling with right now? Well, affordable healthcare, access to care, the rising cost of care, and there's a lot of challenges, administrative challenges. So we've been actually talking to a lot of folks about the fact that many individuals are struggling trying to get SNAP benefits, trying to be able to get enroll in Medicaid, and it's going to get even tougher with the job requirements. And so like these type of issues, generally speaking, what happens is they contact an organization, and the organization has a small group of people that basically answer the questions. And typically the person puts in a request and it sits in this queue, could be answered maybe within a day, a couple days, but more often a couple weeks, and maybe not at all. And as you think about all the information, these requests coming into a small group of people, this is actually where agents, specifically AI agents, have been very helpful. Because what we're realizing is that rather than waiting for this to be read and evaluated by an expert, what we can actually do is we can do real-time adjudication and empower those individuals so that they can actually use the agent, find the answer, and answer it right away. Real-time adjudication of those answers for the individuals, make them super efficient and allow them to be able to address many of the questions. And so, like, this is a great example of something that's actually happening right now. Several states are doing this. Another one is we're starting to see the real opportunity to completely change the concept of where and how often healthcare needs to be accessed. Imagine not having to go to a doctor's office for an actual visit. We are actually seeing that we can apply AI on large populations using everything from an EKG to your voice to a retinal exam and find a ton of disease. And that is being done across the country. So I'll give you an example. In Texas, working in collaboration with the University of Texas in Tyler, the first 50 patients that were seen in a clinic, they were using routine retinal exams as the person comes in, they get their vital signs, they get their eyes checked, but the AI was taking a look at the eyes, the retinal exams, and they were finding a ton of disease, specifically diabetic retinopathy. One out of every five, 20% of the patients that came in had advanced stage diabetic retinopathy, and their average hemoglobin A1C was 10.5%. These are people that actually had blurry vision, but they thought it was just they needed the glasses. They didn't even realize it's because their diabetes is actually going to make them blind in the next 3 years. So we found those, or they found the patients, and now they're bringing them to care. And that's just like a great example. With the retinal exam, you can also do screenings for cardiovascular disease, hypertension, chronic kidney disease, even biomarkers for Alzheimer's, MS, Parkinson's, in addition to all the ophthalmologic conditions that can be identified. So with just one image. And this is something that is now fully automated. It doesn't even require individuals. We could bring this to other parts of the world. So this is what's exciting. AI allows us to sort of rethink what's possible, be able to help scale the limited resources that we have, and think about how we can bring this to regions and parts of the world and in our lives that are oftentimes inaccessible.
I love that. I think that's such a good example of how these technologies can truly impact population health. They can help our patients get what they need in a way that then becomes integrated as part of the health system.
Right. One
So
other thing that I wanted to add to that, because interestingly enough, finding the disease was the easy part. The hard part is once you find it, how do you manage all these patients? And so what we've realized is the second critical piece to this is AI for risk stratification. Because if we can identify the sickest of the sick, those that actually, if you don't intervene, they're going to have some really bad results. You can actually have the biggest impact in terms of cost reduction, morbidity reduction, and also in terms of our ability to manage the limited resources that we have. So what we did is we actually took a look at that. We've been looking at those folks that have the highest severity and bringing them to care. And then the rest of the folks, rather than sending them into the system, we're looking at ways that we can use digital tools to be able to manage them virtually, digitally, and through other types of mechanisms. And this changes the paradigm of like, what's the value of telehealth and remote patient monitoring? Is it really just as a means to, as an alternative for in-person? But in this scenario, your option is you either don't get seen for like well over a year, or you can be seen right away. And it just gives people a greater appreciation of that when you have a large demand, these tools become essential, not nice to have, but essential items for your armamentarium.
yeah, and it really goes back to finding the tools that are solving problems and then measuring your outcomes and really looking at the patient outcomes. It really ties a lot of what we've talked about together. I love that. And, a lot of times when I speak with physicians and other healthcare leaders, the questions that I get from them are, there's so many tools out there. How do I know which ones are going to have impact and which ones I should be using? So, from a technology vendor perspective, I would love to hear your thoughts on how can we help guide our clinicians in the selection of these tools, and how can they think about making sure that the ones that they choose really are going to be most impactful?
Yeah, this gets back to what we talked about before. As we've been thinking about responsible AI, a key part is testing and monitoring. And if organizations are doing that and defining the metrics to success and we're sharing it, it allows us to be able to then determine which type of solutions are actually working and which ones are not. And I feel like that gives people and organizations a better understanding of how to be able to vet the types of things out there. And then may end up being that, you as an organization don't have the time or bandwidth to vet every single type of company out there, but through this network, we actually now have the capability. So that to me is like one way that we might be able to address this. Another thing that we've been thinking quite a bit about is if you're a clinic or a hospital and you're bombarded with a lot of different, I'll call it startups or companies that are presenting solutions, each one of them is valuable by itself independently. But when you kind of think of it collectively, you're like, wow, okay, so I have to have this device with this data goes here, this device for this condition, and this. And as a clinician, what do I have to have? Like 10 different devices, one for every single thing? It's just not doable. And so what we're now trying to get organizations to think about is there a way that we can capture the image or the information once and then use AI, multiple different sources of AI, and apply it on that same type of image. And that is going to require a little bit of herding of the cats because it changes the paradigm of each site being able to create their own solution to creating, we'll call it a unified platform or a unified way for us to be able to organize things. And it doesn't have to be on the same platform, but as long as it's in a standardized way, allows us to be able to then apply AI on those type of images or resources in a way that allows us to be able to create efficiencies and economies of scale. And that is also another thing that's necessary because the user experience, when you have too many solutions out there, can be very daunting.
Yeah, one of my favorite quotes, and people have heard me say this before, is when people ask me when they're building tools, what are some of the things I should consider? I always tell them if you build it, they will not come unless it's integrated, right? And it's so important to think about the tools truly being a part of the solution and being a part of the clinician workflow. So I know we have a lot of folks in the audience that are probably thinking as they get back to their clinic or their healthcare system, what can they do next? And I'd love to hear from you. What are some actionable items that we can have as takeaways for our audience? And while we do that, and for our audience, if you want to throw some questions into the chat, we'll have an opportunity to ask Dr. Rhew a few of your questions before the end of the webinar.
Fantastic. So I think that most organizations right now recognize that AI is going to have a significant benefit to both themselves as an organization and their patients, and they're looking for ways to adopt it. But the challenge is the staff, is the organization ready to be able to use it? So this whole concept of AI upskilling and reskilling is essential. We have to do this in parallel with the actual development and deployment of AI. And it's not as simple as, hey, we just need to find the best AI, deploy it, and forget about it. Because what's happening is a lot of times people are saying, well, if this does it as well as an individual for a certain task, do we need that individual? And that's been one of the biggest concerns. My recommendation is that rather than thinking about it as an individual level, let's think about it at a task level. Is the task that the actual AI is doing a value added task or a non-value added task? If it's a non-value added task, then AI should come in and replace that. If it is a value added task, let's find a way to augment that capability. Similar to what we just talked about with the Medicaid enrollment and the SNAP benefits individuals, those are people are providing valuable services. We need to augment their capabilities so they can do many more things. And similarly, we can do the same thing with clinicians. We have an ability to augment. So how do you get to that? Well, there's three steps that we've really been starting to see. One is education, just kind of basic education of what AI is and what's responsible AI, what's the difference between agentic AI, things like that. But the second is experiential learning. If you can actually have hands-on where different groups are using the tools, building the tools, testing it out in their own environments and showing that this is actually creating value, that is so powerful. And if your organization supports that in a secure, we'll call it a playground, that allows you to be able to test without worry that the information is going to somehow leak out and just encourage that. That could allow you to be able to then get to that third phase, which is an amazing phase where perhaps if we can validate that these workflows are better than what we did before, create job descriptions around it and hire and train people for that. That just changes the whole paradigm of AI taking away jobs to AI creating jobs. But in order for us to do that, the organizations have to take the leadership to be able to identify ways that AI can be applied and build that structure so that individuals can follow it to become able to use it.
Yeah, I think that's a really great point. And there's so much discussion about the fear of taking away jobs. So I love the conversation of how we can change that paradigm and focus in a way that this can actually create jobs and really solve problems, again, as we talked about. So we do have a few questions in the chat. Let's start with someone that asked for you to discuss your thoughts on the idea of having independent labs vetting algorithms so that the burden does not fall to independent health systems.
Yeah, I think that, there's a lot of value in terms of having organizations kind of share and collaborate in ways that allow us to be able to do things that one organization couldn't do. Whether it's a lab, whether it's through these collaboratives like Train, honestly, there's different flavors for different individuals depending on different scenarios. I think that the key issue is no one site can do it by themselves. If they try it themselves, they will quickly hit the ceiling. And so there has to be some mechanism of creating a network that allows them to be able to do secure sharing of information that is at the model level. And to me, that's essential no matter what approach we take. But I do feel that right now most organizations are just trying to figure out how do you actually do this. So we're in the crawl phase. I think most organizations haven't even started processes where they have governance in place, where they have testing and monitoring. I mean, monitoring is a big piece. If we could actually put in processes to monitor and identify what we're monitoring and how we're measuring that, and do it in a way that's standardized, that would go a long way for us to be able to achieving the value of the collaborative that we're just talking about here.
Yeah, and that is a really important topic. We've touched on it a little bit today. That has come out from our survey results across the board, this fear that the tools will not be monitored and that there's not a feedback loop. And so I think part of it is monitoring the technical aspect of the tool, and the other piece of it is allowing for clinicians to provide feedback to the organization, the practice, the technical teams when things don't work as they should.
That's right.
Right? I mean, we expect that technology is not going to be perfect. I think we all understand that. And yet there's this fear when it doesn't work and there's not a place to go that people lose trust in the tools. And I
That's
think that's
right.
going to be, right? That's going
Everything
to be a
has
big
to
part.
be iterated. It just, it's going to get better. But if there isn't a process for iteration, there's that feedback loop. There is no way for it to get better. So we have to build that in, and that means really changing the whole paradigm of what we think of AI and software. We're so used to this concept where you have a model, you already have a software, it gets FDA cleared, you deploy it and you forget about it. I mean,
Mhm.
that has been our model, and we continue to do that. We now have to actually start thinking about, well, is the model going to drift? Are we having different patients? Are we going to actually have different data sets? And in order for us to know whether it continues to work beyond the first day of implementation to a year from now, 5 years, we have to have that feedback loop. And if every site were able to do that, that would be great. But if we had a network and we were all doing it in the same way, we're implementing it the same way, we're measuring it, we can actually then rely on the network. And that's really what we're trying to do. We're trying to find ways that we can work better together, but it has to be done through some level of collaboration and standardization.
Absolutely. And we've gotten away with often not having a feedback loop, not because it's best practice, but because the risks weren't quite as high as they are today, right? So
That's right.
absolutely, this is going to be important. Next question is, does AI improve patient engagement and cultural competence? What do you think?
Well, I've got some great examples because yes, we know that one of the things that AI is quite good at is it actually can speak, you can use any language at any grade level and communicate with it, and it'll come back with an answer. And so long as the AI has been vetted as, in terms of its ability, I think we have a great opportunity for us to be able to use this for engaging patients at any different grade level, at any different type of language. In fact, many of the things that we just talked about with regards to the Medicaid individuals, the employees helping to assist. We're also looking to activate the voice activated piece to that, where the patient could be speaking in a different language with the individual who's speaking in a different language. And all of that is then now being brought back to both the individual as well as the patient during that same encounter. And I think that that's the type of opportunity we have with AI. We can really extend beyond it being just a tool for the internal use to ones that can involve the patients and to allow for them to understand and be able to become much more active in their own health.
I think that's fantastic, and I am particularly excited about the translation tools that has been missing in our healthcare environment for us to be able to deliver the same level of care to patients that aren't able to speak English. That's wonderful. We haven't talked a whole lot about cybersecurity, so I do want to make sure we cover this question. How do individuals and organizations gain confidence that solutions have adequate cybersecurity? The threat actors continue to increase its complexity, and I think there's a lot of fear in our environment. What do you think?
Yes, that is, I'll call it the foundation of everything that should be built. Let's think of AI as a coin, or at least one side of a coin. The other side is the data. And why do I think of it as a coin? Because the AI needs the data, both for the development and then also for the implementation. The data has to be secure. So you have to have a cybersecurity component around the data. And security is not just about locking it down. It's about understanding that the data, there's many transactions that occur, and there has to be an understanding that there every once in a while there are breaches or there are opportunities, and you have to have the early identification. So what's the best way for us to be able to identify if things are actually happening real time or be able to intervene? Well, of course, you need to have mechanisms to quarantine the certain areas, but you need to have real-time surveillance and real-time updates. And the cloud is really one of those great opportunities. And that's part of the reason why there's been such an adoption towards cloud, because what we have found is that that is actually one of the fastest ways for us to secure large data sets. To give you an example, about a year and a half ago, Microsoft and Google rolled out a program in rural hospitals to basically roll out cloud with cybersecurity. Because what we wanted to do is we wanted hospitals to be able to take advantage of not only the AI piece, but also the fact that the data would need to be secured. So there's programs that can be run and implemented through the cloud that traditionally it would be harder to do. And let's imagine we found that there was a hole or a breach or a possible breach. We can actually send a patch out and immediately update that to all different systems if we had that capability. And that's what we're looking for, real-time updates. And so data and the data security and the cybersecurity are like the foundational piece of everything that we're talking about here.
Wonderful. Well, thank you so much. There are other questions. Unfortunately, we're almost at time, and so we won't be able to get to them. But thank you for being here with us. Really appreciate the insights, and I'm going to pass it back to Alec to wrap us up.
Sorry, folks, I'm working on one screen today, but great discussion. Thank you all. Thank you all for participating and putting in your many, many questions. I understand we were not able to get to all of them, but hopefully I can answer a couple of them for you real quick right here. At the end of this event, you will be presented with a brief survey. You can take the time to answer the 2 questions there. Please, your responses will help guide our upcoming programming to help deliver webinars you want to see, such as the one you saw today. And as a reminder, we have provided today's slides and a selection of relevant resources for you to explore, which you can access at any time by selecting the Resources button on your Zoom menu bar. You will be able to view this event on demand an hour after this presentation using the same link you joined with today, and also on the AMA Ed Hub, where you will be able to claim your 0.75 CME credits. And finally, if you're looking for something in person to do from the Steps Forward Innovation Academy, We would like to invite all of you to join us at our next Saving Time Practice Innovation Boot Camp in Chicago next April. This 2-day in-person boot camp is specifically designed for clinical and operational change agents looking to eliminate unnecessary work and free up more time to focus on patient care. If you have interest in attending, you can follow the link in the Resources tab. For any additional resources or guidance to support your physicians and staff, please visit the American Medical Association website or stepsforward.org. We thank you again for joining us and hope to see you again soon.